If you want an effective form of decriminalization, you have to have actual mechanisms in place to divert people into healthcare. The BC government just assumed that if you quote unquote destigmatized drug use, then somehow people would be less embarrassed to seek treatment, and therefore they would, do so more often. But to my understanding, there's not a lot of strong evidence backing that, and oftentimes people, continue to use drugs because they're locked into addiction, right? They don't quit until there's a really strong reason for them to. And an embarrassment is not something that really dissuades many people.
But if you fear police interaction, then aren't you going to go do those drugs alone or somewhere private? And that increases your risk of dying from a toxic dose, doesn't it?
Well, so that's a different issue, right?
Okay.
So now we're talking about, the benefits of decriminalization, not about whether or not we have mechanisms in place to divert people into healthcare. Sure, some people who use alone, that's a bit more dangerous. I think that you have to balance that against the potential public harms of decriminalization.